Pulmonary embolism is a medical condition characterized by the formation and embolization of blood clots in the pulmonary arteries. It is a potentially life-threatening condition that requires careful understanding and management. In this detailed script, we will explore various aspects of pulmonary embolism, ranging from its pathophysiology to its diagnosis, management, and long-term complications. By the end of this script, you will have a comprehensive understanding of pulmonary embolism and its clinical implications. Pulmonary embolism commonly occurs when a blood clot, known as a thrombus, develops in the deep veins of the lower extremities, typically the legs. These clots can dislodge and travel through the bloodstream, ultimately reaching the pulmonary arteries. The most common source of these emboli is deep vein thrombosis, DVT, which occurs when blood flow becomes stagnant or turbulent, leading to clot formation. Once a clot reaches the pulmonary arteries, it can obstruct blood flow to the lungs, leading to various clinical manifestations. The degree of obstruction and the patient's underlying cardiopulmonary reserve determine the severity of symptoms experienced. In severe cases, pulmonary embolism can result in acute right heart failure and even death. Pulmonary embolism is a widely recognized condition that affects millions of individuals worldwide. The precise incidence and prevalence vary across different populations, but overall, this condition is more prevalent in older adults and individuals with certain risk factors. Common risk factors for pulmonary embolism include 1. Previous episodes of deep vein thrombosis or pulmonary embolism. 2. Immobility or prolonged bed rest. 3. Major surgery or trauma. 4. Pregnancy and postpartum period. 5. Active cancer or recent cancer treatment. 6. Hormonal therapy, such as oral contraceptives or hormone replacement therapy. 7. Inherited thrombophilia. 8. Obesity. 9. Smoking. Understanding the epidemiology of pulmonary embolism is essential for risk assessment and prevention strategies. By identifying individuals at higher risk, appropriate measures can be taken to prevent the occurrence of this potentially fatal condition. The clinical presentation of pulmonary embolism can vary widely, ranging from asymptomatic cases to those with severe and life-threatening symptoms. The signs and symptoms primarily occur due to the obstruction of pulmonary blood flow, resulting in decreased oxygenation and increased pulmonary vascular resistance. Common symptoms of pulmonary embolism include 1. Sudden onset dyspnea, shortness of breath. 2. Chest pain, often pleuritic, worsened by deep breathing or coughing. 3. Hemoptysis, coughing up blood. 4. Tachycardia, increased heart rate. 5. Tachypnea, rapid breathing. 6. Hypoxemia, low oxygen levels. 7. Syncope, fainting. The severity and clinical presentation of pulmonary embolism depend on the size and number of emboli, as well as the presence of pre-existing cardiopulmonary disease. Prompt recognition and early intervention are crucial to prevent further complications. To manage pulmonary embolism effectively, risk stratification is crucial. Various scoring systems, like PESI and SPESI, assess severity and predict prognosis based on factors such as clinical presentation, stability, and biomarkers. Accurate risk stratification aids in treatment planning, optimizing outcomes, and resource allocation. Diagnosis of pulmonary embolism involves a multimodal approach, utilizing imaging techniques, laboratory tests, and clinical decision rules. Computed tomography pulmonary angiography is the gold standard, while VQ scans are useful for patients with contraindications to CTPA. D-dimer levels and clinical decision rules aid in the diagnostic process. In summary, when considering a possible pulmonary embolism, it is important to carefully evaluate and differentiate it from other conditions that have similar symptoms, such as acute coronary syndrome, pneumonia, COPD exacerbation, and anxiety disorder. Various diagnostic tests can assist in making an accurate diagnosis. The immediate management of acute pulmonary embolism involves stabilizing the patient and preventing clot propagation. Treatment includes anticoagulation therapy, such as unfractionated heparin or low molecular weight heparin, followed by long-term oral anticoagulants. Surgical embolectomy or catheter-directed thrombolysis may be considered in some cases. Ongoing monitoring helps guide treatment duration. Long-term management of pulmonary embolism aims to prevent recurrence and manage complications. Anticoagulation therapy is the mainstay, typically continued for at least 3 months, with extension based on individual risks and benefits. Vena cava filters may be used in high-risk cases. Lifestyle modifications also play a role in prevention. In conclusion, the management of patients with massive or submassive pulmonary embolism requires timely recognition of hemodynamic instability and prompt intervention to stabilize their condition. This may involve resuscitation measures, thrombolysis, and hemodynamic support to improve outcomes. Chronic thromboembolic pulmonary hypertension, TEPH, is a complication of pulmonary embolism where unresolved clots obstruct pulmonary blood flow, leading to increased resistance and right heart failure. Treatment options include surgery and medication therapy. Long-term monitoring is important to identify TEPH symptoms. To prevent pulmonary embolism, it is important to address modifiable risk factors such as smoking cessation, weight loss, regular exercise, and the use of compression stockings to reduce the risk of deep vein thrombosis and subsequent emboli formation. Clinical practice guidelines provide evidence-based recommendations for the diagnosis, treatment, and surveillance of pulmonary embolism. Familiarizing students with these guidelines ensures up-to-date knowledge and optimal patient care. Key guidelines include those from ACCP, ESCAPE, and BTS. In conclusion, understanding pulmonary embolism is crucial for effective patient care. By staying updated on its pathophysiology, diagnosis, and treatment, medical students can improve outcomes for future patients.